There we go. So very quickly again, my name is Pam Valvano. I'm with Telligen. I'd like to introduce our counterparts at the department. Karina Barrick is one of our colleagues over at the department. Karina, would you like to introduce the department team?
Happy to do so, Pam. Thank you. Hi, everyone. Welcome. I'm Karina Barrick with HCBS. I work with over cost containment, which we'll be chatting more about today. And for our next introduction from the department, I will pass that to Amanda.
Hi everyone. Happy Thursday, holy cow, and happy August. My name is Amanda Smith. I'm the policy advisor for IHSS here at the department. And I will pass this on over to Danny. Danny, are you here?
Camera does not want to unmute. Okay, there we go. Hi everyone, I'm Danny Comstock. I'm the Participant Directed Programs Lead, so I focus primarily on CDAS policy and also help on the Telligen contract related to the health maintenance activities reviews. And I don't know if we have anyone else from HCBS here right now. We might have Nushina, our contract manager.
Hi, yes, this is Nushina Burgess. I am the contract manager over at the department. And yes, I think that is it for the HCBS side of things.
Okay. Thank you all. Thanks for being here. I'll quickly pass over to the Telligen team. April, do you want to get us started? Please tell us who you are and what you do for the contract.
Hi, everyone. My name is April Kelly. I am one of the reviewers over the URUM reviews. We do OCC, IHSS, CDAS, CES, and CHCBS. So I am one of the reviewers that takes a look at all of the cases. Nice to have you all here today. I'll pass it over to Susie or Angie.
I'll go. This is Susie Lincoln. I am a nurse reviewer. I also do all of the cases. And so, yeah, CHCBS we'll be talking about today. I do those, and IHSS, CDAS, OCC, combo reviews. I do them all. It's nice to meet you guys. Thank you.
Thanks, Susie. Angie, do you want to say hi?
Hey, I'm Angie Hanson, and I too am a reviewer with Telligen. I usually work with IHSS, CDAS, some of the CHCBS, and I also work some with HBU. But we are thankful that you all have joined us, and we are glad to help in any way that we can.
Thanks, Angie. Julie, are you here? Okay, Jen, are you here?
Yep, I'm here. I'm Jennifer Tafoya. I am a nurse reviewer. Getting my feet wet in the CES reviews right now. I'll also be learning SLS reviews. And yeah, I'm really excited to be a part of this team.
Okay, Joy, are you here?
I'm here. Hi, my name is Joy Followell. I'm also one of the nurse reviewers with Telligen. I work on the IHSS reviews as well as CES, SLS exception, and a little bit of the CHCBS reviews as well.
Thank you. And is Jasmine here? I think she's out today. Am I correct?
No,
Jasmine?
I'm here.
You're here. Good. Okay. Hi, Jasmine.
Hey, my name's Jasmine. I'm a nurse reviewer. I do all the same fun stuff as Angie and all the people we heard from before. It's good to be here. Nice to meet everyone.
Thanks, Jasmine. All right. Did I miss anybody? Okay. Very great. We'll get going with our presentation. I'm going to turn this over to Karina, who's going to talk with us for over cost containment. Karina?
Thanks, Pam. I just wanted to say, if you're a case manager and you're on this call, thank you. We know you're very busy and appreciate you making time. We thought today would be a good opportunity to just do a refresher on over cost containment, what it is, reviews, processes, and ready for the next slide, Pam. So over cost containment is a part of utilization review, utilization management, also known as URUM. URUM is necessary to ensure that the services requested reflect the needs of the member and that there is no duplication of services. This is based on the level of care needs, clinical necessity, amount and scope, appropriateness, efficacy of health services, etc. And currently, Telligen is the vendor who conducts these reviews and who you work with to complete these reviews. Next slide, please. What is over cost containment, also known as OCC? OCC is a type of URUM review that looks at all of the HCBS services and home health services, if applicable, that a member receives. It's a snapshot of the entire picture of member services. Cost containment is a federal requirement, and the purpose is to ensure that HCBS services are delivered in a cost-effective way. The waivers that over cost containment applies to are the community mental health supports waiver, brain injury waiver, elderly, blind, and disabled waiver, and the complementary and integrative health waiver. There are a couple exceptions where over cost containment reviews are not required, and they're very specific. So if a member has the brain injury supported living program and this is the only service, an over cost containment review is not required. Or if the member has a mental health transitional home service and this is the only service, then again, an over cost containment review is not required. Next slide, please. So the current threshold of when OCC reviews are required is when the average daily cost of services are $315 and above. Effective September 1st, this will increase to $330 a day. So any reviews submitted September 1st and beyond need to or no longer need to meet that $315. The threshold will be at $330. Next slide, please. Case manager responsibilities. So case managers are responsible for completing OCC reviews annually or anytime an increase in services is requested. So for example, if a member had an OCC review completed and approved at their annual assessment, 6 months later, they add additional services, this would require a new review. Case managers are also responsible for following the URUM process and complete a review prior to the service start date. These services need to be clearly and thoroughly documented, justified in the assessment, and case managers should provide all documentation and ensure that there is no duplication of services. Next slide, please. This is just a broad overview of how the OCC process looks. We are aware that there are individual case management agency processes in place and recognize that you likely have an internal process in addition to these steps. But from our end, the first step is there's a need identified for an over cost containment review. So a member is at that threshold and requires a review. This is also where you would identify the type of review. It may be just over cost containment, or it may be over cost containment overlapping with CDAS, or over cost containment overlapping with IHSS. Next, the case manager would submit all documentation in Qualitrack. Again, a reminder here that OCC reviews all services, so all services needed to be submitted in that review. Next, Telligen will review and issue an outcome. If the outcome is an approval or partial approval, the case manager will then upload the outcome letter to the bridge. A note, if you do receive a partial approval, please ensure that you're adjusting the units on the PAR the units authorized on the outcome letter should match the PAR. And all of these steps should be completed before the PAR is submitted. Please don't submit a PAR prior to completing these steps. It can clog up our system process and delay the PARs that are ready for review and approval to be submitted. And once you do submit that PAR, you can notify the OCC inbox to request PAR approval, which happens in 5 to 10 business days. I would broadly recommend that you have some process for verifying the PAR is approved, whether this is through an internal process, checking on the PAR after 5 to 10 business days, or receiving a PAR approval email from the overcost containment inbox. Ultimately, as a case manager, you're ensuring the member has a PAR approved. Next slide, please. This slide identifies the required documentation and optional documentation for OCC reviews. Optional documentation is required if it's applicable. So, for example, you have a member who's receiving IHSS and remote supports that meets the criteria threshold for an OCC review. You would submit an IHSS OCC review, and for that documentation, you would include the long-term care screen, the IHSS plan calculator, the IHSS agency plan of care, and the review case ID, and also the remote support plan. These documentations are on the provider user guide and will of course be sent out with these slides. Next slide, please. That wraps up kind of the broad overview of overcost containment. This slide is a resource for reference for you regarding the most updated memo, of course, the URUM website, which we've mentioned a couple times. And for now, I'd like to open up for questions. Is there anything that we can answer?
If you have a question, you can put it into chat. If you're on a phone and not using Zoom on a computer, go ahead and take yourself off mute and ask your question, or you can do either one, either way. Any questions for OCC for Karina?
Heather, I see your question. Can you please share the slides for this meeting for our new hires? Yes, Heather, the URUM website is where we keep our office hours. And this slide deck, along with the recording, will be uploaded after that gets reviewed and approved through our internal process. So likely sometime towards the end of the month, beginning of September, for your reference.
Thanks, Heather. Anyone else? Questions on OCC? Okay. We'll go on to our next topic, which is CHCBS. We got a request through, oh, I'm sorry. I'll put this back on. There we go. Hi, everybody. We got a request through our form that the department hosts to give some information on CHCBS. So we pulled this together. The questions were about procedure codes and when to submit. So this little chart here for CHCBS tells you what procedure code is recommended that you use or requested that you use. You are able to choose others, but this has been the recommendation of the department in Telligen since we started doing these reviews, to use H2014, H2014 when you're doing CHCBS. If you're doing CHCBS alone, that's all that you need, and Qualitrack requires that you put in one code. So be sure that you are using that one. That tells us and helps us at the end of our month and year reporting on what has been input to Qualitrack if you use this code. If you're doing CHCBS plus IHSS in an overlapping review, we ask that you use H2014, again, same one for CHCBS, and that you use these two codes for the IHSS part of it when you submit. 99509 is a generic code that we've asked for all of our HMA service reviews. 99509 is a code that tells us what you're doing. On 99509, we have asked that that's where you include the total average daily cost for all the HMA services. That's the number that shows in the PAR. It's inclusive of any long-term home health. So it's all the cost of the services, the total average daily cost that contributes to the case potentially being over cost containment. So that's the number we're looking for just on that code. No other costs are needed on other codes. And then also when you're doing CHCBS plus IHSS in an overlapping review, please include H0038. And on that code, please include all of the hours that you are requesting for HMA. So when you put in the requested number of minutes, it should be the total that's on the bottom of your IHSS care plan calculator over in the HMA column. That's the one that goes with that code. If you're doing IHSS only, please use the two codes that are there for IHSS, 99509 and H0038, in the way that I just described for the overlapping. And then when to submit. For CHCBS alone, without IHSS, you would submit at the initial review, at the inception of the service for the individual, and then also every plan year. So when the certification period starts again for the continued state review. For CHCBS with IHSS, you would submit at initial and again at CSR, but we also wanted to remind you that you can submit that as an overlapping review anytime you know that that person is getting both CHCBS and IHSS. Sometimes, and we see this relatively often, the child will start on CHCBS and IHSS will be added later. You can start that by submitting a CHCBS only review and then adding IHSS for the remainder of the cert period in a separate IHSS review. You don't have to resubmit for CHCBS if they're already approved for that certification period. When it comes to their first anniversary and their certification period is starting again, you can use that overlapping review to submit for that year if you would like to. Okay. Also, we wanted to make sure, just a reminder that the PMIP is needed for initial reviews only. You do not have to submit it every year. Okay. I'm going to go to the next slide and just talk a little bit about the criteria. This question also came up for CHCBS. This is information that we've shared with case managers when they ask. It's what we look at for our reviews. Basically, CHCBS is for children that are medically fragile, so they have intense medical needs or clinical health needs, and we like to see that documented in the 100.2 and any other documents that you submit. It's really important for us to get a picture of each child and their unique circumstances. So Telligen will go look at the 100.2 in CCM. You don't have to submit it. We'll go ahead and look at it there. And what we're looking for is for you to really outline what their circumstances are, what their diagnoses are, what their care needs are. That also helps us with understanding the picture along with the other documentation that you submit. So we don't have a required specific piece of documentation, but what helps us the most is that we like to know what their care needs are. How often are they going to medical appointments? How often do they have therapies? We don't need to have a schedule of their appointments. You can just tell us they go to the doctor once a week or they go to the doctor twice a month. And the doctor does this and they go to speech therapy for this, or they go to OT or PT this often, and this is what their goal is. It helps us get that full picture painted for this individual to know about the frequency of the appointments and what they're for. It tells us more about their condition and the intensity of what kind of treatment they're getting. That helps us understand them and determine if they are medically fragile for CHCBS. I've covered what to include as I've talked about this, but just to point it out one more time, please include the child's needs in their condition, the circumstances for them, meaning what are there any special circumstances that we need to consider, what cares are needed, what interventions are being provided to them, any therapies that they have and their frequency, and anything else that might support that this child is medically fragile. I have a note up above that I wanted to just point out to you. I know you're probably reading it. CHCBS is different from the CES, the Children's Extensive Services Waiver, in that it is really directed toward children with medical fragility. Some children may have both medical fragility and perhaps an IDD condition. And they may have some behavioral needs as well, and they could potentially be on either waiver. But we do look at what those needs are, and for this waiver, we're primarily looking at the medically fragile area for CHCBS. Again, that may be a choice that the family, in conjunction with, the case manager's input or advice, chooses one or the other. In those cases, we certainly can consider whatever you and the family apply for in the review. But for some children who don't have these intense medical needs, the CES waiver may be a better choice. So we just are putting that out there as a reminder for you. Okay, finally, if you're using IHSS with CHCBS, be sure to include all of the documentation that is needed for IHSS. And all of that, the requirements for that for IHSS are in the URUM provider manual. And there's a link to that here, which you can get to. I also put that main link in the chat a little while ago. I'll do it again when we're done presenting. So if anybody joined late, you have that link to get to all the resources, including the provider manual and the requirements for IHSS. One more reminder, please be sure and include your long-term home health PAR and 485 if this child receives long-term home health. It's important that we see the entire picture of how this works if they have IHSS with long-term home health. One of the best ways to show us how this works for this child and their family is to give us a schedule of when long-term home health is doing a service and when IHSS is doing a service. We do check to make sure that they're not overlapping. So often a calendar, a schedule, a spreadsheet, a narrative, maybe a Word document with a table, any of that will help us understand how the care is planned to be delivered or is being delivered, and which service, long-term home health or IHSS, is providing those cares. Okay. That's all I have for CHCBS based on the questions that were asked from the form. So I'll pause here for a moment and see if there are any questions from you for CHCBS. Okay, the only thing I see, Cindy, your audio is breaking up. If anybody else is having audio issues, will you please let me know? When I was listening, I was hearing everyone, so I'm not sure if it's on your end, Cindy, or coming from me. So if anybody else is having audio issues, please let me know in case it's coming from me. Okay.
I can hear you just fine, Pam.
Great.
I haven't heard anything break up from you.
Okay, awesome. Thank you, Danny. I appreciate it. Matthew, you're also having audio issues? Audio clear. Okay, so it's a mixed bag. Okay, thank you. Thanks, Matthew. I appreciate you all responding and letting me know. Sometimes it can happen from any one point where we all are gathered here on Zoom. So sometimes with Zoom, if you log out and log back in, that can be helpful with any kinds of audio issues. There's also settings on your individual Zoom in your computer that may help. Okay. Back to CHCBS. Are there any questions about what I spoke about? Good, Diane. Glad you got reconnected. Thank you. Okay, question from Anissa. Should we include all diagnoses in the ADL summaries, regardless if it's applicable in the ADL? Can I call on our CHCBS reviewers to help with that question?
I can talk. This is Susie.
Thanks, Susie.
Yeah, you don't have to put it in every single one. I've seen that a lot where it's in every single ADL, which is just the copy and paste thing, but just one place in there would be fine. Just pick one and put it in there if you need to explain that information, or put it in the at the end in the memory section. That would work too. Just as long as it's someplace we can see it once, it's good enough for me.
Thanks, Susie. We try to make it as simple for you as we can. We know there's a lot of information, so the easiest way possible, as long as you can include it somewhere, that's great. Okay. I hope I say this right. Natieli, tell me if that's wrong. Your question is the code H2014. Is it only to point that it is a CHCBS, or do we need to add time there too? You need to fill in the required fields when you put it in Qualitrack. So it does point to the fact that it's CHCBS, but anything that's not required in there, you don't have to fill in. For CHCBS. For the HMA portion, if you're doing IHSS, so you've added the H0038, we ask you for the total number of hours you're requesting for the HMA portion. Same for CDOS, you fill in the total number of hours based on that total average daily cost that you see when you put the PAR in. So for CHCBS, you don't have to put that in.
Yeah, Pam, and I'll add to that too for CHCBS for that H2014 code, just the one unit. Just one unit in there is fine. We'll take that. And then for the HMA codes, just make sure that's in minutes, and not hours, but just in minutes.
Thank you, Susie. Yeah, when you put in the IHSS code or the CDOS code, you can change the unit qualifier from units to minutes. Sorry, it is not in hours. There isn't an hours option there. You should put in the total number of minutes, your calculators, your IHSS care plan calculator, and your CDOS task worksheet. Add up all the minutes for you, and you can get the minutes right there from that worksheet and just plug that in on that code, the T2025 for CDOS, the H0038 for IHSS. If anybody has questions about that, let us know. Okay. Anything else for CHCBS? Okay. If anything comes up, just note it and we'll come back to it here at the end. We're going to move on to supported living services exceptions, SLS exceptions. Karina, did you want to take this one?
Happy to do so, Pam. Hi, everyone. Again, Karina Barrick, also work with SLS exceptions. This is a reminder to let you know that there will be a new SLS exception request form on the website on September 1st, so coming up. General recommendation, go to the website and download the form every time you need it, just because updates do occur, rather than saving it to your desktop. Your reviews will not be accepted if they're utilized on a previous form. Any questions about that? Seeing none, but I'll still be here for the remainder. I did put the SLS exception website link in the chat for reference for you all.
Thank you, Karina. Okay, the next topic here is IHSS. We got a question from a case manager asking about what to submit for documentation. So we're going to review that real quickly before we go on to wind up our presentation. We talked a little bit about IHSS during the CHCBS portion. As I mentioned before, the Telligen staff will get into CCM and look at the 100.2 for our reviews, and any other documentation that outlines the individual's needs, the interventions being provided, etc. So whatever you submit is what we're going to look at. And again, we're asking you to paint the picture of this person, and just remember that Telligen hasn't met the person. We are relying on the case manager to let us know what the person needs, what their circumstances and conditions are. So we appreciate what you do submit and tell us about them and what's in the 100.2. The 100.2 is really important to us. It should include the person's needs outlined. Again, their condition, their circumstances, their diagnoses, what their care needs are, what cares are being given to them. That helps us a great deal. We also require the IHSS Care Plan Calculator. That one is on the CDCO website. I think all of you probably have that, but that is where you can locate it. Also, we need the IHSS Agency Care Plan. And just a reminder that the requested minutes in the care plan should match what's in the calculator. And you get to that as the case manager works with the agency to come up with a care plan for the individual. The care plan should reflect what's in the calculator and vice versa. If there's a big difference in what's in the care plan and the calculator, we'll be sending you back an RFI to ask you about that and see what's happening, why there's a difference, and which is the correct number. The correct number should be in both of these documents for the services that are being requested. If the individual has long-term home health, we need the long-term home health PAR and the long-term home health agency care plan, the 485. In our last office hours in May, we went over these in some detail. So if you weren't at that office hours, we have information on that. The slides and the write-up from the office hours are on the department's website. You can access that there. If you have questions about whether to submit it or what to submit, you can always go to the support center and put in a ticket, and either the agent or one of our operational team will get back to you and answer your question. Same thing for the private duty nursing plan. If the person receives private duty nursing, we need to know what the plan of care is for that. Ideally, if the person has IHSS and long-term home health, IHSS and private duty nursing, any combination of services, we like to see what is being delivered and when. That just helps us understand how all of the coordination of services is happening and that there isn't an overlap between one provider and another provider. So the best way to do that, again, is some type of a schedule, a spreadsheet, a calendar, a table in a Word document. Any of that will work for us. Narrative that tells us how this is being delivered. If you want to just write it out in words, like with the service, you could do that as well. So please let us know if you have any questions on that. It is most helpful. When we get all of this, we RFI for less. So please be cognizant of what's needed for IHSS documents, and we appreciate you getting all of that. There are some optional documents that we often see or that we'd like to see. The IHSS exercise plan, it's not required, but it does help us understand the person and what's being done for them, how often and when. So we love to see that. Any medical records you think are relevant to the person and to helping us understand their circumstances or their condition or how service goes in their home or with their providers, that's great. Any previous service plans can be helpful. Medication lists can be helpful. Again, not required, but helpful. So if you feel like it makes a difference to this person or to help us understand who the person is, we would appreciate seeing that information. I see that Amanda posted the link to the IHSS Care Plan Calculator on CDCO's website. Thank you, Amanda. Appreciate it. The CDOS worksheet, task worksheet is also there on CDCO. So thank you for doing that. I'm going to pause here for any questions on IHSS. I'm going to try to catch up. Our chat monitor can tell me if there's anything in chat that I haven't seen.
We're all good in the chat, Pam.
Okay, thank you. So any questions for, I see somebody put in a Q&A. Why do service providers not use the same care plan calculator? That's a good question. I honestly don't know an answer to that. I don't know if anybody at the department may have some thoughts about that. To my knowledge, you're talking about the IHSS agency, I believe. They, I think it's not a requirement, but other than that, that's all I know about it. Does anybody else have any other input on that?
Sure, Pam, it's Amanda over at the department. Happy to take that question. So, agencies are not required to use the same calculator, though they can use it as a tool. So they will provide case managers with their own version of a care plan that should encompass essentially all of the same tasks and any tasks that are being completed for that member.
Okay, thank you, Amanda. Any other questions about IHSS? Okay. I see from Lisa, you had a member with long-term home health and they don't bill Medicaid for the IV infusions. I think, Lisa, I think this was something new that we hadn't seen, and we worked with the department to understand what the situation is. April, would you be able to speak to that for a moment?
Yeah, hi. The department might be able to speak to this a little bit better too. I know this just came up. So in this particular case, we had a 485 and we didn't have a long-term home health PAR attached. And we ended up finding out in this particular case that the pharmacy was actually, or I'm sorry, Medicaid was actually paying the pharmacy rather than, I could be saying this wrong, but basically the long-term home health company was not billing for this particular IV medication. So in this particular case, we did not need a long-term home health PAR. I think these are going to be one-offs. So as we see them, we will handle them. If we're not quite sure what to do with them, we do always reach out to HCBS. So sometimes the case does sit for a little while, just depending on the circumstance, but hopefully that answers your question, Lisa. We did go ahead and approve that one, I believe. I'm sorry, there was an RFI attached to that one, but hopefully the long-term home health part was cleared up on that one. If anyone has anything else related to this that you'd like to bring up, now would be a good time if you've seen anything like this. I know this is the first time it's come up for many of us, so just throwing it out there if anyone has anything. Otherwise, we'll move on.
Can I speak to that? So we were not able, we got a complete denial on that. It did get kicked back to us with a complete denial. Pam, I did email you yesterday on it because we submitted it for another review. And then a different reviewer reviewed it, and it came back with a completely different review with other things that didn't come back with the long-term home health along with it. It was a completely different review. And so this isn't my case. This is a different case manager's case, but I'm helping him because he's a new case manager. So, but I did email you, so I don't know if you can look at it and just kind of maybe, reach out to us so we can look at it and see if we need to follow up on it, and we'll change what we have to, but definitely if we can look at that.
Yeah, thanks, Lisa. I'm sorry I was out for a little while yesterday afternoon, and coming in, I haven't quite caught up yet on the emails, but I will find it and get in touch with you. I also wrote a note. So I will be back in touch with you. Thank you for asking about that and letting me know. All right, we'll figure out what's going on with that one. But as April said, I think it depends on the various circumstances, and this is something that's a little bit more unusual, but we did reach out to the department for guidance on that. Does anybody from the department have anything to add to this kind of unique situation?
This is Karina. April, I think you did a good job explaining that. And I think more importantly, if there is a specific case, please continue to do what you're doing, which is reach out so we can work with you on that.
Thank you, Karina. Yeah, that's always the key. If something isn't the way you think it should be, let us know, put in a ticket. You can send an email. I always advise, Lisa, that people put in a ticket because if for some reason I'm out and you've emailed me, I may not be able to get back to you as quickly. So if you put a ticket into the support center, multiple people monitor the tickets that are coming in. You can even put in your ticket that you would like me to be in touch with you or one of our team members to be in touch with you about this situation. It's not something the agent is going to solve, but they're absolutely aware that those kinds of questions are going to come in, and they escalate them over to our operational team so that we can help you with that. But that way, if I'm out, April or somebody else would be able to pick up the ticket. Okay. All right. Thanks, Lisa, and I'll be back in touch with you about it. So Denise asked for anybody who isn't seeing the chat, is it possible to put the task definitions back on the care plan calculator? And Amanda responded that she's happy to take that back as a possibility. Thank you, Amanda, for responding to that. Okay, Allie, your question. Asking Amanda, case managers are still responsible for approving the care plan, correct? That was a question, and Amanda responded, yes, that's correct. Is there any follow-up to that from anybody? Anybody have any questions on that? Okay.
I've just seen an uptick in providers pushing back and doing their own care plans without justification, or, it's not what was reported in the 100.2. I don't know if anyone else is seeing that issue. So I just wanted to make sure that, that's not something that I missed, that we're still all on the same page. The case manager ultimately has the responsibility of approving the care plan based on the 100.2 and the in-person assessment.
Is there any, thank you, Allie, for that. Is there any other comment or question at all? And I think that information is appreciated, Allie. Thank you.
I was waiting to see, hey, it's Amanda at the department. I was just waiting to see if other folks have experienced this. But Allie, thank you so much for that question. I would say this does happen often where there may be some pushback from agencies or just that they may be seeing something that wasn't captured in that 100.2. In those cases, I would say yes, it does come down to the case manager reviewing and approving. But if there are particular cases where you're finding that there's discrepancies between both care plans and we're not finding a resolution, you're more than welcome to reach out to me and we can find a resolution for it, as well as just going through and asking for that justification from the provider is more than acceptable as well.
Thank you.
Okay, I wanted to pop back over here to the Q&A part of this. There was a question in here: when submitting for IHSS HMA as well as OCC, what procedure codes are required for the review outside of the HMA minutes of service and the average daily cost? When it's OCC, we ask you to include the relevant procedure codes that relate to the service the person is getting. I think the best example of that might be transportation or emergency notification services. All of those procedure codes for people that are doing OCC with IHSS are in the procedure code and modifier list that's on the department's website. So this is more inclusive. Of course, when there's OCC, there's really no other way for us to know all the services other than the calculator. So we ask you to put all of the other relevant codes on so that for our reporting and record keeping, we know which codes apply. We'll put the link in again for the department's website. Look in the training section. You're going to see procedure code and modifier list down there. And that gives you all those codes that they're slightly different than the codes you may enter in the PAR system. So please be sure that you're looking at that list when you enter it into Qualitrack. They are as close as they can be, but the modifiers are slightly different. So please look for those codes and use those for OCC. I hope that answered your question. If you need more information, you can raise your hand or put in another question. Okay. Or tell me right now. All right, Laura asked if the IHSS provider requests an exercise plan, additional time for blood pressure checks, etc., signed off by their nurse reviewer, will Telligen accept? We tell them it should be supported by the client physician. That's an interesting question.
I can take that one, Pam. This is April.
Thank you.
Yes, it is very helpful to see as much information as we can in those agency care plans, but we cannot solely rely on that information to make our determination. The information has to be verified or supported by the case manager. So we would also have to see that information in your CCM documentation and or an uploaded documentation from you, also supporting why those tasks are needed.
Any follow-up to that? Laura, does that answer your question? Okay, thank you. Appreciate it. All right. Everything just moved on my screen. Sadia had a question for EBD clients. For H003899509 code, if the unit request is 1144, for the average daily cost, that WFT showing is 28.2911. Do you need to enter this dollar amount for the 99509 code Telligen submission? So Sadia, this is a little bit hard for me to, this is like a story problem in math for me. To follow this a little bit, I don't know that I want to answer exclusively. What I would say is if you've created the pre-prior approval PAR in the system and you look at the line that says total average daily cost, that's the number that goes in on the 99509 code. The total units, which I believe you're saying is 1,144, would go in on the H0038 code. On the 99509, when you put in the cost, you can just put in one unit. You don't have to put the units there. The minutes is what we're looking for. If the unit, again, the unit requested, if it's 1144, what we've asked you to do is look at the care plan calculator and take the minutes from the bottom of the HMA column and put that into the H0038 code and change the qualifier from units to minutes. I hope that makes sense to you. It's slightly different. The units and minutes are different things. So we've asked, rather than going through any calculations yourself, that you just take the information from the care plan calculator, which calculates it for you. The minutes show at the bottom of the HMA column. Just put that number in with the H0038 code, and then the PAR system calculates the total average daily cost, and it's labeled right there in the box, total average daily cost. Take that number and put that into the code 99509. If there's costs for long-term home health, that should be included and added to that total average daily cost before you put that in if you have long-term home health. Does that make sense? Okay. Thank you, Sadia. I hope I'm saying your name correctly. If not, please correct me. Okay. All right. Did I miss any other questions about IHSS? there was some dialogue on the case managers being responsible for approving the case, and a couple people stating that they've also seen providers adding hours to service plans that are not in the assessment from the case management agency. Courtney has had agency pushback as well. Is there anything else on that, or anything that somebody that needs to be addressed? I think the department, correct me if I'm wrong, but they're hearing that there's some agencies perhaps that are not, that are pushing back to case management agencies, the provider agencies.
I'm going to go ahead. Hey, everyone, it's Amanda again over at the department. I'm going to go ahead and put my contact information as well into the chat. So if anyone has particular cases or providers that we're having difficulty with, feel free to just let me know.
Thanks, Amanda. Okay, we'll go on. This is close to the end of our presentation here. We have a few more slides for you, and then we will stop the presentation and have general questions and answers. Here's a page that has resources for you. Again, the link to the department's website is on this page. I just made a list of some of the training materials. This is pretty common that we have these training materials on the site. These are the ones that I think are the most useful for you. Be sure and check the URUM provider user guide for all of the basics about all of the reviews. This includes what codes to use, what documentation to submit with it, what's required, what's optional, when to submit in Qualitrack, how to use procedure codes, tip sheets. For anybody wanting to do an express review, I highly recommend tip sheet number 4 if you've never done it before. You can also call the support center and have them walk you through the process of doing an express review. Same with a reconsideration. If you get a result back and you want the case reconsidered, reconsiderations are explained in the URUM provider user guide, and the process just is a little bit different than submitting a review. But if you've never done that, you're welcome to call the support center, and the agent can walk you through the process. They can share desktops with you so that they can guide you through what to do when you're doing a reconsideration. You want to make sure you go to the very end and get that very last item clicked so that the reconsideration gets back into the queue. And then I also want to remind you, this is not on my slide, but please be sure you're using Chrome when you're using Qualitrack. There are some things that happen with other browsers that don't work as well with Qualitrack, so we always request that you use Chrome when you're working in Qualitrack. Okay, those are all my resources and reminders. I'm going to put this link to the support center in here in just a minute again, but we'll go on. This is new information for some of you who might be new to our sessions, or those of you who remember we did this last year at this time. The Telligen Annual Satisfaction Survey opens today. We would love your feedback on your work with Telligen. It's a very short survey. It should only take you 5 to 10 minutes to do. The survey will remain open until September 12th. There's a link right here. I'm going to post that here in the chat in just a second. And we're going to send you all an email. Anybody who is a user in Qualitrack will get an email with a link to the survey as well. I thank you in advance for participating and giving us your feedback. It really does help us with our quality improvement efforts, and lets us know what you need from us as a vendor and contractor to the state. So thanks in advance, and we hope to hear from you in the survey. All right. We're going to go ahead and go just tell you here that our next training is going to be in November. We actually just set a date for this. I'll get that posted into the chat as well. The PASSAR quarterly training is November 7th. This quarterly office hours is the following week, same schedule on Thursday. I'll get that date for you. When we did these, we hadn't quite set that yet. So I'll put that into the chat, but we hope to see you again at office hours. And just a reminder, we have a write-up document for office hours that contains all the information from all the office hours that we've held. We update it every time we hold a quarterly office hours. It's really useful for specific items, questions that people have asked. It's organized by topic, so hopefully you can access that on the HCBS website. If you have any questions about anything, again, contact us in the support center. So I'm going to stop sharing this. We're at the end of our presentation. I'm also going to stop the recording and restart it. And we do this so that people are comfortable to ask questions. The Q&A part is not going to go anywhere. We want to make sure that you're asking various questions. We do ask you not to bring any private health information when you're doing questions and answers here in the session. We do have this recording. If you have anything case specific that you would like to discuss with us, you can let us know through chat, or come off mute here during the Q&A and let us know you have a question on a specific case, and we can get back to you, or you can put in a ticket in the support center. I'll get all those links uploaded again here in just 1 second. I'm going to stop this recording.